powerful. So in each session, we'll meet an Oklahoma family caregiver who walks us through their personal journey. Our goal is to listen collectively to their needs and leverage the full spectrum of resources and expertise in this room, the 360 degrees of our coalition, to identify concrete, immediate ways that we can offer support. So, based on the positive energy and engagement we saw during the pilot, it's clear this segment is doing exactly what this coalition is here for, moving us beyond the planning phase and directly into immediate action and input. So, I'm thrilled to introduce the Caregiver 360 segment today. Please join me in welcoming our featured caregiver, Leslie. Leslie's an amputee from Tulsa who cares for her mother in her 90s and has macular degeneration. Her mother is a former nurse and loves to read. Leslie enjoys playing pickleball, basketball, mountain biking, sledding, and walking her dog. Leslie, we're thrilled that you're here. Will you take a few minutes to tell us about your journey of caring for your mother and what resources we could assist you with along that journey?
Thank you. Um, my mother, we have a caregiver 9 hours a day, so that helps, except for when she has problems with her Kindle. So I go over there and help her out. My mom's 5-day-a-week caregiver is 85. She's Philippine. She's never even called in sick. And then on the other 2 days, she has two different girls. On Friday, the one is in her 20s. So I'm off Kindle duty on Fridays, at least those 9 hours. And my mom's a fall risk. She's broken her pelvis and several bones in the last 9 years. She's been hospitalized 4 times for it. But my mom, she loves to read. She did go to church before COVID, but then since COVID, she hasn't gone. And I don't know if you guys are experiencing, but the longer they're not in social settings, they don't feel very comfortable. Like I couldn't get her to go to my grief group Thanksgiving dinner, which was only 10 people, because she didn't really know them. So, um, so she goes to the beauty shop every week. So that's good. But that in doctor's offices are really her only outings. Her macular is getting worse. So, um, the specialty vision place worked with her for about an hour and a half, and they figured out that she could read with a black background and white letters on their biggest font. But some days that is starting to become a challenge. So I'm looking into trying to find ulterior ways for her to read or to be read to. We had Audible. Well, she accidentally subscribed to it, and I didn't figure it out for a few months, so I've been being billed for it. And but she subscribes to Kindle, so I don't want the two services. And hopefully, I can find something out there that is, not expensive or doesn't cost, because she's only listened to one book on tape. She's very stubborn, um, because she's been on her own since she was widowed. My dad died when I was 15, so at 39 years old. So she's used to, doing everything for herself and calling the shots. And this has been, and nurses aren't easy patients to begin with. So all of that, she tries to take the wheel a lot, and I'm trying to learn to let her. When I went to the OK Cares conference, the biggest takeaway was if they're in their own home and they want it done a certain way, it doesn't matter if it's the right way or the wrong way. You need to do it the way they want it done. I told her that last night. I didn't tell her I went to a caregiver conference because she would hate to think of me as a caregiver, although she knows I am, but that just admits that she's losing more independence. And she just laughed when I said, Mom, when you said you didn't want the air fryer on the counter, I could hear that speaker saying, okay, you have to do it their way. So anyway, she just laughed. So that was good. I told her I was doing the conference today for ideas. But anyway, so that's I'm an amputee. I joined the center when I lost my leg several years ago. 10 years next month. And so I play all those sports to try to stay healthy, mentally and physically healthy. It's a good outlet. I've started adaptive mountain biking, and when I went to Bentonville and did adaptive mountain biking, and I came home after 3 days of being in the woods and riding, I was like, okay, I can handle anything that mom throws at me. And I did. I mean, it carried for a while. That is so important for you to take care of yourself, especially mentally when you have to deal with aging parents. Because I really don't know where I would be without the sports. I never played sports till I got hurt. And I walk my dog every day. And I was grinning when I heard some of the people talking about how 57 is too cold to walk. My thermostat's broke. So I don't put on pants because I wear shorts year round when I'm walking Bentley unless it says it's 27 or below 27. And I don't wear coats. Very seldom do I. Yesterday I had to take off my jacket mountain biking because it was 40s, and I ride an arm cycle and a hand cycle and use your arms. And so I got hot really fast. But my one leg was cold, so I didn't go to hockey because it was cold. But anyway, that's in short what I'm dealing with. I live 3 blocks from my mom, so it helps when I get those calls in the middle of the night that her fall necklace has gone off, because she does not want an ambulance to show up. She does not want her neighbors to to see that an ambulance or the fire department shows up to her house. So she doesn't like me scooting up all her steps in her townhouse when I get called in the middle of the night. But I said, it's me or the ambulance, Mom. So pick your poison. So she does have stairs, but I installed an extra handrail and asked her, to use both handrails. Her doctor's okay with it, even though she's a fall risk, because he feels like that's helping her with some physical activity since she doesn't get much. And my mom has COPD, pretty bad. She's on oxygen at night, but refuses it during the daytime, even though she's out of breath a lot of the time. But anyway, so that's my story.
Just so inspiring and um, good for her and you, um, for doing things your way. That's so great.
That's
We've
hard.
got. I have no doubt. As you were talking, I was remembering my grandmother who lived independently till she was 91, and she refused a walker because it just was not a good look.
Oh yeah,
So yeah, I can you were bringing back memories, so it's great.
she
So we
wants
have
she
some.
wants me to take her out to eat, and I said, Mom, I need an able-bodied person to go with us, so we need to go during the hours of your caregiver. No. And I said,
Right.
Mom, that is your choice because I
Yeah.
can't keep you safe. I used to use my old wheelchair where she could hold on to it because it has
Hmm.
handles. I have a low back, so I don't have handles on my other wheelchair, but I used to use it. But the last 2 times, my mom would say, slow down. And I said, Mom, you're the one pushing me. And, and so after 2 times of that, it just made me too nervous because she got nervous. So
Right.
that's just kind of, I'll go pick her up something and take it to her, but that's kind of my rule.
Hmm.
Sorry, Mom, we've got to have an AB go with us.
Right. Right. Yeah. Well, we have some ideas in chat. We're going to take a few minutes for people to talk about some resources. One question that was asked, is your mom on the Advantage waiver? Um, Someone talked about free downloads from the library for book access. Um, what else,
Now,
guys?
the books from the library, don't they have like with the physical books, they have so long that you can use them?
Yeah, but they also have Audible books that you can download. And in the chat, I think it was Edwin that put it's called Hoopla app, and you connect your library card, and you're able to download Audible books. And then
But
someone else put into
but
chat that I'm sorry.
can you keep those more than when you download them from the Audible? Can you keep them longer than 2 weeks?
You would just have to
Usually you
recheck
can,
them
yes.
out.
So I'm
Which
trying to
is,
avoid less work on my part. She
yeah.
doesn't know how to operate any of that. Either does her
Mm.
5 day a week caregiver. So I'm trying the most simplest thing, so that
The Oklahoma Library for the Blind has devices that they will send, and you can keep them for longer, and the devices are easy to operate, and they have a huge selection. So I put the link in the chat there.
okay.
And we can get
Okay.
the chat information to you, Leslie. Don't worry about that part, okay?
Okay, thank you. I'm writing notes and I'm not that fast. So okay.
That's okay. We can
Thank
take care
you.
of that part. No problem.
Okay. Thank you.
Yes. Other ideas? Or other questions?
Did we get a response on whether or not she was taking advantage of Advantage
Oh,
waiver?
yeah, Leslie,
What
is
is
your mom?
that?
Okay, we'll get that information over to you
Is it
too.
income based?
Yes.
My mom doesn't have a lot of money, but I'm sure she doesn't qualify.
Okay, well, it's still worth looking into. Definitely just get you the information.
Okay.
Yeah, it would be good to check it out for sure. Definitely.
Okay.
All right. Well, are we ready to move on? Leslie, thank you so much for sharing your information and being here with us today. It's a great reminder of why we
Oh,
all
I'm sorry. I just remembered. New View is the name of that place. If anyone's
yes.
parent is struggling with their eyes, like that, like I said, they spent an hour and a half with my mom trying to figure out a way that she could still read.
Oh, that's
And it was
fabulous.
New View.
New View's so wonderful.
Yes. Yes, they are.
Yes.
Okay.
Awesome.
Thank you.
I love these photos. This is great. Whoever put that together, thank you.
Lloyd did, I think.
Awesome. Great job, Lloyd.
Oh, I want to point out in the picture with my mom working on the table.
Yes.
She has 3 great grandchildren that live out of state, and she hasn't even we haven't met them, but she wanted to send them $10 because we don't know what toys they have or anything. So I got kits at Hobby Lobby, these foam kits, and I ordered blank cards from Amazon. And then I helped her. I help with putting the glue on. She did one and it went everywhere, but that's okay. She couldn't see it, and she didn't know the glue went everywhere, so I didn't tell her. But I just kind of set it up with her and showed her where to press it down, and it was a really fun activity. And so that's an idea for anyone else listening that it made her feel good that she was doing something in part of a Christmas project.
Definitely. That's a great idea.
Thank you. I used to be a teacher, so.
Okay, I see. That makes sense. So great.
Okay.
I've worked a lot in my past background before leading age about active and healthy aging, and there's different dimensions of wellness and vocational and spiritual dimensions of wellness. Talk about being able to, no matter what our abilities or limitations, being able to contribute and give back, and that's a great example. So love that. Well, great. Thank you so much, Leslie. We wish the best, and you're on this call right now, but we're all available at any point, tomorrow or 3 years from now, to help figure these things out for you.
Thank you.
So next on our agenda is Erin Parks from the Oklahoma Family Network. Erin's going to give us a brief overview of programs that OFM offers for families caring for children with special health care needs. So Erin, thanks so much for being with us today. I'm going to turn it over.
Yes, absolutely. Should I just say click whenever it's a slide to do the
That'll work.
slides?
Yes.
Okay, and we'll go through them really fast because I wanted to get as much information. I know I have 10 minutes, so I'll be aware of that. And so here's our information. Click. I'll just say move. I don't want to be bossy. It sounds bossy. And so Oklahoma Family Network, again, my name is Erin Parks, and I'm located in Tulsa, but we cover Northeast Oklahoma. I will introduce my coworker who's on here as well. Actually, we have two coworkers, but Nancy and I do a lot of work together, and she'll be talking about her support group and just introducing herself. But Oklahoma Family Network, we are a statewide nonprofit organization that offers families help with special healthcare needs and behavioral health challenges. I really want to make sure we hone in on that, is that you do not have to have a diagnosis. It could be maybe someone is experiencing some issues at school, having questions about IEPs. Maybe they just are having anxiousness and their child's not wanting to go to school. So we could actually help that. You do not have to have a diagnosis for us to talk to you. Also, I want to say, click. I feel weird saying click. But if the next one is one thing that's really important to us is we're just improving the lives. Think of us as providing emotional support and resource navigation. So that is our thing, is we want no family to feel like they are alone. We want all of us at Oklahoma Family Network, we bring lived experience. I myself have a daughter with Down syndrome and behavioral health challenges, and a son that's given me permission to share that has gone through the ADHD, 504, and depression and anxiety route. And we've been able to get a lot of resources. So there's nothing better than talking to someone that has lived that had a little bit about that journey. Okay, next, please. So I'm just showing you this very quickly to show that we've been around for a while. We actually started back in 1996. We were part of the Special Parents Access Network was started, and then we combined. So in 2022, we were celebrating our 25 years. So obviously we've been around for 28 years. So something that a lot of people don't know about is that we have been around for quite a while. Next, please. So our goals, what does Oklahoma Family Network do? Well, we try to decrease that family stress and isolation, like I mentioned before. We try to increase the family's knowledge and use of resources. My favorite quote that I always like to say is, you don't know what you don't know. So we have to provide those resources to families. And if I don't know, or one of our staff at Oklahoma Family Network, we don't know the answer, we're going to do everything we can to find that answer for you. We also try to enhance those partnerships between different community partners and the families, allowing them, teaching them about advocacy, and trying to make sure that they know that their voice matters. Next. So how can we help? We can connect families with our OFN. We have a support parent training, and we offer that one-on-one. I do a lot of stuff along with our other staff at Oklahoma Family Network, meeting in coffee shops or libraries. We do those kind of things to talk to the families, and we meet them where they're at. We want to equip them with the resources and information that they need, but we also want to make sure that they take that next step and they know they feel empowered, and connecting them to resources. Next, please. So we have three buckets of support three buckets, I should say, at Oklahoma Family Network. That first bucket is emotional and family support. Again, we're doing that one-on-one parent and caregiver matching. A lot of times we will go up to the hospitals. We'll give patients gas cards, care baskets. Just giving them that helping hand. So we do those home visits with other staff. We can't go by ourselves, but I do a lot with DHS as well. And I'll walk alongside that DHS caseworker and go visit them in the home to make sure that they know of all those resources. We also have support groups online and in person. We have a podcast, which I love, called We Saved You a Seat, that has over 80 family stories of inspiration and encouragement. And we also have lots of social events as well. That is all encompassed in that emotional and family support bucket. Next, please. Information and training. This is one I really want to hone in on with you guys. We do a support parent training where we actually train parents to learn how to support one another. We do a care notebook training. This is on our website. I really encourage you after this to go to oklahomafamilynetwork.org and go over our website. You'll see the bucket, information and training, and click on all of the trainings that we have available that we can come and do with a group of families that you're serving. We can do it with your staff. We can do it at a support group maybe that you're hosting. And these are all free of charge, and we do them across the state. The Care Notebook one, all of the documents are located on the website. And what I really wanted, this is for all ages. We started it with just being for children that had special healthcare needs. But as we've done, I've been doing this a lot with grandchildren or grandparents, I should say, and especially those grandparents taking care of their grandchildren. But also we've been doing it with just, for example, that you were speaking earlier, we could do a care notebook so you would then could do it for your mom. And then all those nurses would have all that information in one place. That's called the care notebook. All of those documents, there's about 100 documents that you can download off of our website. We do a life course training, and we also do a community resource training where we'll tell you about all the different resources in the state. Next, please. So the other part of that information and training is we do a transition care notebook. We also do pre-service training, developing family voice and family advisories. And one of my favorite ones is telling your story training. That's where we teach families to advocate for themselves and how to tell their stories, whether it be at the Capitol or whether it be to their child's teacher. Next, please. That third bucket of support is advocacy and leadership. We have a conference. I'd like everybody to make sure you jot it down. March 27th is our Joining Forces conference. If you haven't been to our Joining Forces, it's a very great conference where we talk about family and professional partnerships. So it's a time where we get families and professionals in the same room to talk about some of the issues that we're having within our state. We also do regional institutes. We do family voice leadership stipends. For example, we have family leaders that we have a council that we have, and we stipend them because our view, and I'm sure most of you follow this, but if a family is going to give up their time and I'm getting paid as a professional, that family should get paid as well. So we really try to stipend our families. And we have task force, a child welfare birth advisory, and different advisories at different levels. Next, please. We are part of the Oklahoma Children's Behavioral Health Network. And again, you can share these slides with whoever, so they'll have this information, but we have 5 Facebook pages across the state. So whatever region you are in the state, if you would like to join that Facebook page, we have all kinds of information. And if you ever want us to put something on that Facebook page for you, please don't hesitate to reach out to one of us, and we'll put that on that page about one of your events. Next, please. We have a supporting network in the NICU, the Neonatal Intensive Care Unit. It's our NEST program. We actually do support groups, we do reunions, and we're supporting families that are in the NICU at the different hospitals. We're located in Baptist in Oklahoma City. We're here in St. Francis, but we also have relationships with St. John's and some of the others. But we actually go up there and talk to those families and try to, make them not feel alone and give them those resources while they're in the NICU. Next, please. We also have the Families Fighting Childhood Cancer. This is something we have an entire staff group. They do their own support groups and retreats. But this is something that if you have a family that has a child or gets a new diagnosis, we have the absolute best staff that have walked that journey that they would love to talk with them. Next, please. I told you I was cramming in as much as I could. And this is our Cultivating Connections group. This is that parent support group where they talk about the oncology and hematology concerns, and it can be a great resource. Next, please. This is our Finding Calm in the Chaos. This is one of the fun things that we do. Every Thursday, we do virtual yoga. You can turn your camera on, you can leave it off, however it is. This is for families, this is for staff. We have counselors that do this with their kids during school time, but this is something that, again, you can go to our website, you can use this QR code, you'll register, you'll be sent a Zoom link, and it's all about just finding the peace in the moment. And as we all know, we need to learn that self-regulation. Next, please. So this is our podcast that we talked about. It's called We Saved You a Seat. They're all broken down into different categories. So you can see whether it's behavior challenges, whether it's substance abuse, Down syndrome, autism. We also have these in Spanish as well. So make sure and check out our podcast. Next, please. We also have a YouTube channel. Can't forget, this is my favorite because there's all of our past recordings. We do monthly mental health presentations, and all of our past recordings are on our YouTube channel. And if you ever, I'm saying this to everybody on this call, if you listen to one of our YouTube's presentations and they really resonate with you, our presenter is a elementary school counselor. She gives the presentation along with all the handouts to us. So just email us at OFN and I can send you the whole bundle. The best one I would say that we send out to the most is helping the anxious child and developing the growth mindset, the 5 love languages of children, creative consequences. Those are all on our YouTube channel and we can send all those handouts to you. Next, please. And I'm flying through the rest of these. And the Toolbox Tuesday is the second Tuesday of every month that can provide, we have resources on agencies. Our monthly mental health presentations are, again, those monthly topics like sibling rivalry, the growth mindset, dealing with anger in the family. And then we put those recordings on the YouTube. Next, please. The next one is SIB shops. SIB shops is where it's for the siblings of the children with special needs or behavioral health care. We have 2 groups that Oklahoma Family Network does, but there's some across the state. We do this in partnership with Sooner Success and several others. But SIB shops, we can't forget those siblings. Sometimes we focus on the child with the disability or the behavioral health, but we need to focus on the whole family as a whole. Next, please. This, Nancy, can you just unmute maybe and just say hello real quick? I know we're on a short time, but this is Nancy Jerez. She is over our Hispanic community here, and she has a support group that she does monthly. Nancy, would you like to introduce yourself for just a minute?
Yeah, well, my name is Nancy Juarez, and I work in Oklahoma Family Network, and that's right. We have a support group, Pasito Pasito. That is only in Spanish because it's only for the Hispanic speakers. So that is support for the parents who had kids with special needs or behavioral health challenge. And as an immigrant, we have a lot of barriers. So, and when they have children with special needs, is a little bit more complicated because they don't know how working the system. So, the support group give them to the tools for navigate to the resources in the community. At the same time, we help them to just give them support in any way they need it, not only for the kids, even for the adults, for the parents. So, and that is 2 times a month. So they have to register, and after register, they receive a call and interview for one of the facilitator and just give the link for attendance to this support group. Thank you.
Thank you, Nancy. Nancy has done a phenomenal job. And I will say all of our monthly mental health presentations are offered in Spanish at the same time. We have a translator on the Zoom simultaneously. Next, please. And I'll zip through. The less is after this, it's more just questions. And then if you want to go to the next slide, this is how to connect with us. Again, we would love to come and speak to your staff. We would love to come and help any families you serve. We can do that one-on-one. We can do that over Zoom. We have staff located across the state, but truly our main goal is to make families know that they're not alone. And we believe in that family-centered care. So again, a lot of people, we do help children, but if the caregiver is not healthy, kind of like what you said before, if the caregiver isn't healthy, how can they take care of their child? So we talk about making sure that the whole family is cared for, whether that's by emotional support or resource navigation. So thank you very much. Sorry, that was a lot of information at one time, but you can go back to all those slides and just contact us. All of our information will be in the chat. Oh, you can skip through that. That was, I think that one, there you go. That one got on there. I apologize. Thank you for having us.
So much wonderful information. Thank you so much, Erin and Nancy, for sharing. And wow, what a lot. That's just great resources. And for everyone, we will send all these slides out. So you will you will receive a copy of everything. Next on our agenda, we have Alex Roller, who is the Director of Development and Marketing for Woven Life. And he's joined by Sarah Monteith, who's the Director of Children's Services, and Sue Runyon, who is Director of Adult Services. They're going to share with us the various programs that Woven Life offers, including, yay, their newly opened Adult Day Center. That's been a long time coming, I know. So thanks for being with us. Tell
Absolutely.
us what
Thanks so much for having us. I apologize, our slide deck wasn't able to make it together in time. So I'm going to just talk about who we are and what we do. Sarah Monteith, our Director of Children's Services, is on, as well as Sue Runyon. It's a little crazy on our child side today, so Sarah might be in and out. But I'm going to do the majority of kind of talking about who we are and what we do. But Sue and Sarah, certainly, if you have something you want to add, feel free to chime in. I do know we have a few other of our staff on the call as well, listening in. So we are Woven Life. We are based here in central Oklahoma and Oklahoma City. Our mission is empowering people of all ages and abilities to find hope and independence through compassionate care, education, and support. We are celebrating our 100-year anniversary as an organization. We were actually originally founded in 1925 out of the Oklahoma City Rotary Club as the Oklahoma Society for Crippled Children. And services over the years have included, we've done early intervention, vision, hearing, and scoliosis screening services for school children, physical therapy and evaluations, reading, tutoring, developmental screenings, ADHD interventions, clinics, all sorts of things. And so today, what we offer at Woven Life are kind of three main programs. On one side of our building, we have an early childhood development program, which I'll go into more detail here shortly. On the other side of the building, we have our Adult Day Center, which, yes, we are excited, has finally reopened. And I'll get into more of that here shortly as well. And then the third part of our program that we offer is our medical rehabilitation program. So we are centrally located right here on the OU Health Campus near downtown Oklahoma City. We bought our current facility where we are here in 2001. And so some of the great things about where we are is we are centrally located. We have our own parking lot. We have a 22,000 square foot facility for all of our programming here. We're very fortunate to have great security. We have cameras in all the classrooms, all that kind of stuff. We have the OU campus police right here, as well as Oklahoma City Police Department to keep our little ones and adults and loved ones secure. Proximity, we are right across the street from the OU hospital. So if any of especially our adults have issues, we are in close proximity to that. So I want to first talk a little bit about our Child Development Center. We are more than just a daycare. We are an educational institution, early childhood development. We are a 5-star DHS facility and nationally accredited by the National Association for the Education of Young Children. We have a curriculum that spans the entirety of our building, all of our Child Development Center. So all of our classrooms are broken down by age. So we have our infant classrooms, toddler classrooms, 2-year-old classrooms, and then our preschool classrooms. And all of our kiddos are the same curriculum at their age appropriate level. So we focus on helping get kids ready for big kid school so that they can succeed there. So we do color, shape, letter recognition, word recognition. We teach ASL words of the month every month. We have a full-time curriculum specialist and trainer who helps ensure that curriculum is implemented in all of our classrooms and that all of our teachers are able to stay current on their professional development and accreditation, credentials, all of those kind of things. We do pride ourselves on kind of exceeding the expectations, both of DHS and of NACCE, in terms of classroom teacher to kiddo ratio, in terms of the quality of education that we are providing. And one of the things that we really love about our Child Development Center is that our classrooms are fully integrated with children of all abilities. So whether the child is a typical or atypical learner, might have a developmental delay, physical disability, might be on the autism spectrum, anything like that, all of the kids are learning at their age appropriate level together in the same classroom. This does a couple of different things. First of all, it allows kids who are atypical learners or differently abled to engage in the same way as typical learners. It helps them progress more quickly. And for all of our students, it creates a sense of compassion and awareness that there are kids and other people that might be different than them, but they can all learn and be together and in the same classrooms. Part of our mission is to foster that hope and independence. And so in terms of our Childhood Development Center, we want that independence in terms of teaching them communication skills, social skills, that compassion and awareness, all of their physical dexterity and growth milestones, things like that. We have some great partnerships with Oklahoma Partnership for School Readiness, iLeap here with OU Med, Rainbow Fleet, things like that. I did run into one of our parents a couple of weeks ago who works here on the OU Health campus. And her daughter just went through our program and just graduated from our preschool program in the spring and went on to kindergarten. And the mom was telling me how much Maria was thriving and things. And so she passed on this quote, and she said, quote, "Woven Life was so much more than childcare for our family. It was the foundation for our daughter's growth. She started there at age 1 and stayed until she transitioned to public school kindergarten at 5. When she entered kindergarten, her teacher immediately noticed her strong academic skills and confidence, and even commented that it was clear she had come from an environment focused on learning, not just supervision. The caring teachers and thoughtful curriculum at Woven Life truly set her up for success academically, socially, and emotionally. We couldn't have asked for a better start." So that really is the heart of what we want to have our children and families experience as they go through our child development. We have a dedicated chef that prepares carefully crafted meals that exceed nutritional expectations. We are part of the CACFP federal food program, and so we feed our kids breakfast, lunch, and an afternoon snack. We do have a sensory room that was provided for us by the Don and I Foundation that allows our kiddos a play space when the weather is inclement outside, or for some of our kids that might need a quieter, separate space to kind of calm down or have a different learning experience. We have a dedicated library that we were just able to complete from funds from the Sarkees Foundation, so our teachers can take their kids to a special classroom. We've got room for expansion. We currently have about 40 kids. We have the capacity for a little over 100. So we've got room to grow and expand as our enrollment grows. We take private pay, DHS subsidy, and tribal subsidy as well. So that's kind of an overview of our Child Development Center. The other side of our building, as I mentioned, is our Adult Day Center. We started our Adult Day program in the year 2000. We are excited that it is reopened. We closed during COVID, then had a little bit of a flood. I say 65% of our building was flooded that kept us from reopening. So we have finally reopened at the beginning of this year. On our Adult Day side, we do have a capacity for 36 adults. And the platform of our Adult Day Center is to provide a structured daytime program to support vulnerable and functionally impaired adults 18 and older. Most adults that attend the Adult Day Center, they might live in their own homes or they might lived with a loved one, but they're dependent upon the aid of a family caregiver to maintain their independence. And so our hope, again, from our mission statement of providing that hope and independence, we hope that through our Adult Day program, we can help those adults continue to engage in physical activity, social activity, keep their minds going, to keep them as independent as possible, living on their own or with their loved ones, caregivers, so that they aren't forced to go into perhaps an assisted living or nursing home situation earlier than they might have to otherwise. So we do have qualified staff here. We have certified nursing assistants and certified medication aides that oversee the supervision of our participants, monitoring their health services, assisting with activities of daily living, providing support and socialization and communication. We have also a full-time activities coordinator who helps participants engage in activities from games to art, music. We take our adults on outings when we are able, again, to kind of help them maintain some of that social and mental and physical independence as long as absolutely possible. The other thing about our adult day program, we are open Monday through Friday, 8 to 5 for our adult day center. And in addition to providing those services to increase the quality of life for our adult participants, it also allows the caregiver a break from their caregiving duties so that they can attend to personal errands or work or just having time to rest and relax and take a break. And so we want to make sure that that the caregivers know that while they are in our facility, they are going to be safe and well cared for. One of the beautiful things about having the Child Development Center on one side and our Adult Day Center on the other is that we are able to engage in intergenerational programming. So throughout the week, our adults and our kiddos do crafts together, play games together, read books together, engage. It helps both our adults maintain kind of some of those neurons firing and the excitement of engaging with younger ones. And then also for our kiddos, it helps them learn how to develop relationships with older adults in a safe and caring setting. On the adult day side, we do take private pay. We also take the Advantage waiver, DDSD, as well as veterans benefits. The last component that I'll just touch on real quickly is our med rehab program. When we have been a statewide organization and are a statewide organization, even though our direct services are solely located here in Oklahoma City, but we do have endowment funding as well as grant funding from other foundations to help provide equipment and help pay for therapies for kids and families that are unable to because their insurance doesn't cover it or it exceeds what their insurance allows. So whether that's an iPad with an adaptive touch program for kids who are nonverbal, we just purchased an activity chair for a girl in Woodward, Oklahoma, so that she can get around better at school. And so right now, all of our funding currently is for kids and young adults 25 and under. Actively working on finding funding that we can provide some of those services for our older adults. We do get a lot of requests for that kind of assistance for our older adults, and we're working on finding that funding. So that's kind of a really fast overview of who we are. Our web address is there in the chat, wovenlifeok.org. We are enrolling adults and kids at this time. And if you have any more questions, especially about the Med Rehab program, I oversee that program as well, and you can reach out to me directly. Thank you all.
Great. Thank you so much, Alex. I'm going to ask, if I'm sure everyone has lots of questions because they have so many great resources. If you can post in the chat, and we will make sure those are answered via email if we run out of time. But thanks again for sharing such great programs. Next, advocacy is an important part of what we do. So we have Joy McGill from AARP. She's Associate State Director for Advocacy, and she's going to share an update of what's going on at State Capitol regarding caregivers, and it's a busy time of year. So Joy, welcome.
Hey guys, good morning. It's great to see everyone this morning. It is super busy. My update this morning is going to be pretty quick because today's actually the deadline for bill filing at the Capitol, and so we're feverishly reading bills that have been filed. We expect probably more than 1,000 to be filed today, and so there's a lot there's a lot of things out there that I don't even know about, is what I'm saying here. But I do have a really exciting update to share with you all, and then a few other updates of things that I've just found out about that I think are also great news. The thing that I am so excited to share today, though, is that as many of you know, Representative Tammy West carried the caregiver tax credit bill a few years ago that passed. We are expanding that bill the way that it was passed at the time was the individuals receiving care had to be age 62 or older for their family caregivers to qualify for the tax credit. We are going to request a change on that bill this year, that anyone that is a family caregiver taking care of someone that is needing care of any age that requires help with daily ADL, is that right? Activities of daily living of any age will qualify for the caregiver tax credit. So that's so exciting. That's pediatric, that's age 2 to 92, 102, whatever. So that's so exciting. I know that that's something. I see Aida shaking her head. I don't know if that word has gotten to you yet, but I knew that that's something that you would be really excited about. The other thing that's really exciting, we got tons of feedback after the bill was passed that transportation mileage for health to and from healthcare appointments was kind of a missing component as a reimbursable expense. And so we're going to add that in to this year's bill. I don't have a bill number for that yet, but I will have that for you all next time. Also, Melody Blancett, a House member, she's going to be requesting funding for options counseling, which options counseling was passed as a service a few years ago, but it was not funded, which makes no sense, but that's how the legislature works sometimes. Do not have a bill number for that just yet. And then there's a couple of other bills. I know we're short on time, so I'm just going to drop them in the chat that I found out about. I don't really have a lot of information about them, but they look like they're going to be good bills. I'm also going to include my contact information in the chat here. If it's something that you're interested in knowing any more about these bills or have questions or want to get involved on helping to advocate for these things, please do reach out to me. We always need the help. And let the games begin. That's pretty much it.
Well said. Thank you so much, Joy, for that update. And I know the next days and weeks will just be crazy in those worlds. So we appreciate what you do. So thank you for that. All right.
Really quick, Claire, for some reason it says I can't send a message because I'm not a member of the chat. Talina, I'll just email you that
okay.
the information, and if you don't mind popping it in the chat, that info in the chat, then we should be in good shape.
Absolutely.
Okay, thank you.
Yeah, and there's a question about bill numbers, and when we do have bill numbers, we'll send those out for sure. Yes. Wonderful. All right. Well, next up is Aida Stevens with some important updates on our coalition.
Awesome. Thank you so much, everyone. So happy to be here. And yes, Joy, shout out to AARP and all of our advocates of really trying to get that tax credit for all ages. I'm super excited, and anything we can help with, please let us know. So I also want to give a shout out to our coalition, our planning committee, the 2025 Oklahoma Caregiver Conference. And again, as our caregiver mentioned earlier, that was on our 360 Caregiver 360 program. Self-care is so important, and anyone that knows about this conference, many on this meeting are instrumental in helping us implement this conference. This past one, we had over 1,700 register. We had 76 of our 77 counties reach. We had 11 different states. We had 6 in-person locations, 8 watch parties. I mean, you guys that have been here from the onset, this was our 8th annual. We could not do this without your support, without so many on the planning committee and community partners, sponsors. So just thank you everyone for stepping up. And we also already have the next date scheduled. It's going to be November the 5th. So partners on this meeting, please right now take the time, save that date. Let's try to work together so we aren't I think causing, multiple events. I know sometimes you can't avoid that, but now, if you can, take the time, block that date off so you're not booked to be anywhere else but the caregiver conference, and help us get the information to caregivers. But November the 5th is our next date. And just in email to okcares@okdhs.org. If you have suggestions, I know here in Oklahoma City, we were at Embassy. We are outgrowing our space, and we've already been looking to secure a space. So if you have recommendations, could you please send an email? We try to find a venue that has the capacity of 400 attendees as well as 50 vendors. So again, if you have suggestions, please send that to OK Cares email. And if you have nominations, the segment Caregiver 360 is very impactful. And I want to just say, if you have resources for the caregiver that shared her story earlier, we can help make those connections. You can email OK Cares if you have programming that would directly help her. I say all that to say it doesn't have to stop here at this meeting. It is an opportunity for these caregivers to share their story, for us to do our part to better support them. So if you also want to nominate a caregiver to participate, please again send those to okcares@okdhs.org. And then lastly, we're super excited to launch the subcommittee breakout rooms. We recognize everyone is super busy, and so starting today, we're going to have an opportunity for you to join the subcommittee breakout rooms. I want to first thank our leads over the subcommittees. Please be patient with each of us, because this is again going to be a new series that we're going to start. But this is a great way for us to connect and focus on a specialized area or interest that you might be interested. And of course, those that are familiar with the coalition, the subcommittees are able to really work on an area outside of this time. And so super excited for that. And hopefully your schedule permits for you to join those subcommittee breakouts. And that's all of the executive committee updates that I have, Claire. I'm going to turn it back to you.
Wonderful. Thank you so much. All right. So the do we want to try a couple of updates? We've got 3 minutes, so let's offer a couple of updates real quick. If anything else coming up, you can put that in the chat. If your organization has special events or opportunities coming up, please put that in the chat. Our next meeting is here. It will be Thursday, April 16th at 10 a.m. This meeting will conclude upon the adjournment of the subcommittee breakouts. So this is our last time together today as a full group. We so appreciate everything that you do for caregivers. We appreciate the staff that work to make this Caregiver Coalition everything it is. There's a fabulous team of people behind it. So we thank you for everything that you do. And we hope to see you at our next meeting. Here's some upcoming or some reminders of our online presence. Feel free to forward to OK Cares at OKDHS if you ever want us to share anything on any of these platforms. We're more than happy to share your information. And so now it is time for subcommittee breakout rooms. So if someone that knows, oh, great, we have some announcements coming in. That is great. So if someone wants to explain how people get in a breakout room, that would be great. Do they just click on that link, the green link?
I'll jump in here. So yes, they can click on the green link that's on the slide. It is an interactive slide. Or Ashley and I have both put the link on there. If you want to jump over, and we will navigate you to the appropriate breakout room. We hope to see a lot of people jump in, and just be patient. This is the first time we're trying it this way, and it probably won't be the way we're going to do it next time. Or it could be. We don't know. We'll figure it out as we go.
It's got us where we are so far, and we've done pretty good. So yeah. Thank you all. We'll
So
see you
we'll
in
see you
April.
over in the other
Yes.
meeting.
Yes. See how that works.